Hello, good afternoon, everybody. Thank you so much for joining us for our fourth session today, which is going to be on our solutions to help our customers grapple with business operations during the COVID-19 pandemic. My name is Lauren Schimmel. I'm the Director of Healthcare for doForms. And this has just been a really great day. It's our first Mobile Transformation Day conference. We've had sessions all throughout the day on our for our healthcare track, on our advanced security features, our solutions for home healthcare and hospice, caregiver self-scheduling solutions, as well as some really great other sessions going on in the realm of GPS tracking, mobile printing, and a great panelist with our customers. So it's been a great day so far. So thank you for joining us and taking some time out of your afternoon to learn about our COVID-19 mobile form solutions. So let's get started. So we're about 1 year on now, and it's a great time to pause and reflect and really think about how doForms has helped our customers during this last year. It was unprecedented. COVID has upended business operations from coast to coast, all around the world, really changing the way people are doing business, and unfortunately just, affecting a lot of people. doForms was fortunate in that we were able to step in and help our customers, really help them figure out new ways to operate, whether that be, the immediate need to transition from paper forms to digital forms. We were there to help. The need to automate the signature process. So we developed a solution for what we called Contactless Signature. So the ability to go and provide services or do work for a person and then securely forward them a form for signature without any contact. We were able to get those solutions up and running for them. And it really just showcased our product's flexibility and ability to rapidly design and deploy solutions and get them out in the field. So literally, our phones were ringing and we were designing these solutions and getting them deployed in a matter of hours. So it was just a really great way for us to step in and help during this time. Now, for those of you who are kind of new to doForms, maybe you've poked around on our website a little bit, I'll set the stage just quickly on what our product does. We provide you with an online form building tool that allows you to build out a digital form, and the form can be completed on any type of mobile device, whether that be a smartphone, a tablet, or a laptop. You can even build forms that can be published on your website. So you can click a link to fill out a form. So there's many different ways to deploy the forms. The forms themselves can be embedded with all sorts of smart logic, GPS tracking, image capture, video capture, all sorts of cool tools within the forms themselves. And once the forms are completed, they're stored in our portal where you get an online repository and access to all of this information. So just setting the stage a little bit about what doForms is. And as the healthcare director, I work specifically with our healthcare customers, whether that be in the hospital setting, home healthcare, physicians' offices, dental practices, all types of different healthcare organizations utilize doForms. So our form builder is actually HIPAA compliant. We have a whole set of advanced security features from form field encryption to multi-factor authentication into our portal. We do sign a business associate agreement with our healthcare customers. So we have a very compliant solution for healthcare operations as well. So that being said, we have this tool set, we have this platform, and then we have a pandemic. So we have a whole, a wide customer base that's calling us looking for solutions to help them quickly maybe digitize the work order process, maybe pulled out facility checklists, things like that. But we really, for today's purposes, I've bucketed out 5 key areas where we've really helped our customers in the COVID-19 pandemic. The first is the creation of a COVID-19 symptom screening tool. We'll get in detail to each of these solutions, but this tool allows you to screen employees, visitors, about whether or not they have any exposure or are demonstrating symptoms of COVID-19. And we'll talk about that whole workflow. We've helped with contact tracing and follow-up screening. So, if someone is flagged for exposure, being able to track that throughout their organization, or even in the school district where the child might be attending school, we've had some deployments there. Talking about vaccine registration, so the ability to register for a vaccine appointment, schedule that appointment, and then administer the vaccine and get all of that documentation completed. We have a solution for that, which also kind of overlays to a visitor registration process, which we've done for certain businesses that only want to operate at a certain capacity, maybe only having 10 to 20 people in their business at one time. We have a visitor registration process as well. Contactless signatures has affected, all different verticals, all of our customers, not just healthcare, but the ability to send documents for signature remotely in a secure way. That's been really, really critical to business operations right now. And then lastly, we've been doing a lot just in terms of operations and facility management, cleaning checklists, inspection checklists, making sure that certain protocols are being followed. We've developed applications for that as well. So what today's session will be kind of a deep dive. We'll talk about each of these solutions. I did mean to say there is a Q&A function on your Zoom webinar link. So if you have any specific questions, please just pop them in the chat. We'll answer them at the end of today's session. And I'll also be providing my email address. So if you have any ideas or you're looking to do something specific, feel free to email me directly. So let's get started with our first solution, which is our COVID-19 screening tool. This solution is actually deployed now. We are screening tens of thousands of people a day all across the country. They're in various different industries. We have a large presence, of course, in the home healthcare sector. So thousands of home healthcare workers are using our tool to screen every day. We have deployments in schools. School districts are using our screening tool to monitor the health of the students as well as visitors who come on the campus. Universities, and of course, many just other types of businesses, law firms, construction companies are using our screening tool to help them monitor the health of their employees. So let's talk about how it works. The first thing we provide is we provide you with a template, which is, it's been created by best-in-class guidance from some of the leading, healthcare minds, some of our customers that we've worked with. But what it'll do is it'll ask you for your name, your basic information, and then it'll go through a series of about 10 questions about whether or not you're experiencing a temperature, if you have a cough, if you're sneezing, all of those signs of COVID-19 that have been kind of identified. Then we have some exposure questions as a part of this tool. So we'll ask you if you've been in contact with anyone who's positive, whether or not you have traveled, to other countries, some of these other exposure questions that are a part of this. Now, the tool we provide is fully customized to your particular needs. So if you want to change some questions, add some questions, remove some questions, highly easy to do that. We can definitely take care of that for you. But what happens is once the screening tool is filled out, we kind of get to a juncture. So the first juncture is everything is okay. There's been no exposure, identified, temperatures are normal, no signs and symptoms. We think this person is cleared out. If that is the case, they will be automatically sent, what you're seeing on the screen here, which is sort of like a day pass or a boarding pass. And that can be used to enter a facility. So whether it be the school or the business, wherever they need to go, they'll receive this code that basically is good for the day, tells them that they've been screened. And then if you'd like, you can implement a secondary temperature check. So you are documenting that the person is telling you they have no fever, which is good for compliance. But if you would like to document there, you can as well. So what will happen is someone at the door, at the front desk, can scan the QR code and then take the temperature and double verify that that person's okay to enter. All of this then is stored in our online database. So that is scenario A. It controls flow into the organization. It controls that you're screening on a daily basis, making sure everyone has a normal temperature before they're being admitted into the facility. The second node that could happen is if the employee reports that they're having an issue. So they do have a temperature that day, or maybe they, someone in their family has tested positive. What happens in that case is that we escalate that screening tool. So we work with you, you tell us who you want to be notified. That could be a employee health team. It could be a certain, school district, member. It could be whoever you have set up within your business to monitor and track these cases. They will be alerted. From there, they are presented with a series of follow-up questions. So they can contact the employee and get a sense on, have they scheduled a test? When will they be testing? When do they expect their test results in? What the next follow-up date should be. So we give them sort of a portal to help manage that follow-up as well. So not only do we know, that they had an issue, but we track that, we maintain that, and it becomes an ability to kind of do some contact tracing. So what does that mean? So if I know that I am a home care nurse and I now have a fever and my, spouse has tested positive, I now know as the organization that I need to contact everyone that nurse has visited, in the last few weeks to let them know that they may have been possibly exposed. So through this notification and alerting process, we unleash the ability to do that type of contact tracing that's critical, just making sure that everyone's self-contained to prevent the spread. So, again, if they are alerted and flagged for these symptoms, they can receive customized instructions from your organization. It can be as simple as an email that lets them know, please stay at home until you've been contacted, and then, et cetera. So we work with you on what you want the employee to receive. And then, of course, if everything's fine, they receive the stay pass, they can go through. And again, you're just tracking in real time. And what's really interesting is over the last year, we've collected so much data on so many different types of organizations. You can track, out of the student population, what percentage had issues out of all of this, organization. So you can get some analytics out of it if that is useful for you. So our COVID-19 screening tool process, turnkey solution, we can get you up and running in a matter of hours. If you are looking for something to help you manage reopening, we know everyone's eager to reopen the offices, get back to work. This is a great tool that will allow you to do that and effectively manage, as well as implement a policy, which is critical. I think a lot of our customers come to us looking for a strategy. How can we just get started? We need something. We don't know where to start. This is a great place to start. Implementing a policy that requires your employees to self-report, to make them think, make sure that they're not exposing people, and institutionalize this process. And it's so easy. They arrive, they scan their day pass, beep, they get right through. It's a really great way to get started with the COVID-19 screening process. And I want to say, this topic, I'm so glad that there are so many of us joining today just to learn about this. We've learned a lot over the last year, but we were talking, and COVID-19, it's not going to disappear. I think there's going to be so many lasting impacts of this pandemic and how businesses operate, from a hygiene perspective, from a way we work perspective, from implementing solutions like this to protect the health of others. There's going to be so many lasting effects, and doForms is really here to be a partner that's affordable, easy to use, easy to implement, and easy to adapt, so that you really have a tool that you can help meet all of these new requirements. So this is our COVID screening tool solution. If there are any questions, pop them in the chat. If you would like to see a live demonstration of this, please email me. I'd be very happy to get this set up for you. So that leads us to the next sort of solution, which is our contact tracing and follow-up screening. I touched briefly on this when I was talking about our screening tool, but this is kind of, again, the next step. So now you're going to have a database of employees who have tested positive. From an HR perspective, managing that becomes burdensome. You need to understand, what percentage of your workforce is out. You need to understand who may have been affected. You need to understand who you need to contact and be proactive about, staying home and not exposing the risk of others. So by digitizing, by doing the screening tool process, we put all of that information for you in your fingertips. So literally, whoever you designate can log on in the morning and get a list of everyone who is flagged, everyone who has been out of the office, as well as track the last contact date, the next expected doctor's appointment date, the date of their next test. And you can track and really get real-time visibility to understand when people will be back, as well as minimize the risk to other employees. Letting them know that they were at risk. Please stay home and work from home, work remotely until we figure this out. So again, contact tracing and follow-up screening, that is the next step we implement after the screening tool has been deployed. And again, this is highly configurable to exactly what your organization's specific requirements are. We have a strategy, we will work with you. We actually have a questionnaire we can go through together to kind of identify exactly what it is you want done, how you want to track, how you want to monitor this, whether or not you want to automate alerting, however you want to do this, we can help you. doForms is very unique in that it's not a pre-canned product. It's not off the shelf. We don't just hand you this and say, use this. It is highly configurable to meet your organizational's uniquely workflow needs. And again, we're working with healthcare workers in this solution, schools, monitoring students, visitors, faculty coming in, manufacturing facilities, warehousing, all sorts of different solutions. Just really need this as a sort of follow-up to that screening tool process. So now we'll shift gears a little bit and kind of talk about the most current sort of solution out there right now, which is our vaccine registration process. I'll cover vaccine registration and then we'll talk about visitor registration as well. So real world example, we received a call a couple of weeks ago from an urgent care clinic that has received a shipment, their first shipment of vaccines. And they need to get these vaccines in the arms of people. They have nothing. They don't know how to manage it. They do know that they would like to only see about 4 people an hour. They would like people to schedule appointments. They would like people to determine, maybe go through a pre-screening, pre-eligibility form prior to filling this out. And as of course, as I believe the new deadline just, for all Americans to be vaccinated, this is timely, this is happening now, and systems need to be put in place. So we get this call, we are like, okay, we got a solution. The next day, we have this customer up and running with a full-blown vaccine scheduling and registration process that is tailored to their exact location and size requirements. So I stated they only wanted to see 4 patients an hour. That's how we built it for them. People could only register, there were only 4 available slots per hour in the 8 to 5 timeframe that this particular clinic said they would be open for. That is configurable for any type of organization, whether you have 100 clinics or 1 clinic distributing vaccines. What we do is we develop for you sort of an appointment timeframe module. So you tell us how many people you can see in a particular timeframe, and then we build a registration calendar for that. So we allow someone to log in, and this can be done literally by posting a link on your website. So you post the link on the website, someone clicks to register for a vaccine. The form opens. The first part of the form is going to be a series of eligibility questions. Are they over 18? Some other questions that there's still being some studies done about whether or not they should be eligible for a vaccine. Certain age limits, certain, demographic, if they're pregnant, whether or not they should do that. Basically, based on how they answer the question, if they're fine, they're then able to choose to register for an appointment. So if they are eligible to register for the appointment, they'll be able to select their times. They select the date they want to go and the available slots show up. This is all smart. This is all using our built-in form intelligence to tell you there are 4 available slots between 1 and 2. There's 3 available slots between 2 and 4. So we customize that. If all the slots are taken, that time does not appear, so you can't register for that. So we help you manage the capacity. The person selects the time they'd like to do their appointment, submit the form. They're done. They then receive, just like the screening tool emails them a boarding pass, they receive a vaccine registration pass. So that has the date, the time of the appointment, the location of the appointment. When they present that pass at the clinic, they are able to scan that pass, and it pulls up all of their information right there on the doForms app at the clinic. And then they are able to do their further documentation, what vaccine was administered, the dose, how it was administered, the lot number, all of that critical information is captured. So then the clinic has a full-blown record of who received the shot and what dose and what vaccine was administered, which is great, especially when second vaccines have to come up. You have that foolproof check as to what vaccine was given previously. So the systems are smart enough to manage capacity at certain times. And then you also get full reporting of how many visits were performed on a certain day. You can kind of gauge that, and you can, of course, customize this. If you're able to now see 10 people an hour, you can always change your capacity. So we have a full-blown vaccine registration solution that not only helps you schedule vaccines, but also helps you manage and track vaccine administration. You scan the QR code, you administer the vaccine, you document it, the process is done. We have all of these records stored in case the CDC officials come and need to see those records. We have everything there on our online filing cabinet. So the vaccine registration process, it's great. And again, nothing too complex. If you have vaccines that you need to get into the arms of people and you need a solution, please contact us. We can get you up and running. Again, in a matter of a couple of hours, we'll have you going. We have a template, and for those doForms partners out there, if you know any organizations that's struggling with this about what to do, please contact them and let them know that we do have a strategy to help with the vaccine registration process. Now, that same idea of managing capacity can also apply to visitor registration. As schools, as shops and other storefronts open and can only see a limited capacity of people, if you want to register for appointment slots to go into these locations, you can use the same process. So we have a full-blown scheduling solution that again emails the visitor a pass, whether or not when they're supposed to arrive, and you can scan to verify that they are able to come in. So again, really great, very timely solution. We have these deployments going out right now as we speak. People are registering for the vaccine using doForms, and a year later, that is just such a tremendous thing to say. All right, so let's now go to the next solution, which is our contactless signature solution. Now, this applies to any type of form, any type of workflow, any type of business that you're doing. Anything that requires your customer's signature, we can embed our contactless signature workflow. What this does is, if you have a work order, if you have consents, all you have to do is fill out that form on the tablet, and in the bottom, type in someone's email address. As soon as you press send, it's going to send the form to them as a form where they can sign off on it, and as soon as they send it, boom, it's executed. So it's a full contactless signature process. It is incredibly affordable. We're talking pennies for signature, nothing complicated. So if you are looking to work for or to go towards digital signatures, but also have all these forms that need to get completed, doForms is really your sweet spot here. And here's one of our healthcare customers, say, we had to react immediately. Going digital eliminated our unhygienic paper practices. No more getting paper back with bodily fluids on the pages. That was a real quote. During the COVID pandemic, we had a customer call us up and saying, we're getting this is, paper back, and it's, we can't touch the paper. What can we do? So we shifted them to a digital form solution. All of their documentation was now done electronically, completely hygienic. So it's really just a better way to do business. Now, for those of you in the healthcare sector, you may not have joined us this morning, but I do think it's important to point out, all of these solutions that we're building, especially with COVID screening and vaccine registration, where there is a little bit of overlap, anything that's containing patient information or healthcare information, we do encrypt. It is protected. It is secured to HIPAA security standards. Our portal to log in and actually view any of this information is protected by multi-factor authentication. And again, we have a whole secure email and secure workflow embedded for this. So contactless signature in the healthcare sector, if you needed to send over to get a consent, we would use what's called secure forward. And that means that only the designated recipient who you designated should receive this document to sign it can actually open and view it. We use multi-factor authentication to protect that and to authenticate the person that's wanting to sign the document. So contactless signature, again, I'm the director of healthcare. I'm kind of always in the healthcare way of thinking, but applicable to any vertical, transportation, construction, manufacturing, field service, technicians. If you want to do digital signatures, doForms is a great solution for that. And now our fifth category in this COVID-19 solution umbrella really has to do with operational and facility management. So, basic story. So you're going into a hair salon, or you're going in to get, some sort of service provided to you. And now you're being asked to sign a consent. You're being asked, have you had any symptoms of COVID-19, and do you waive, any issues if you were exposed by getting these services, right? So doForms has just been very critical in helping companies get these solutions in their front door. So we can build for them any type of consent that you want customers to sign prior to entering your facility to get that signature and to waive those rights, or waive the liability and the risk of that. We also can help you do, again, the daily screening, but also room cleaning checklists, making sure that everything is scrubbed down, cleaning supply management, all sorts of different forms that are now being implemented that you want to have updated on a daily basis. So you can definitely use doForms for those types of applications. And again, any type of checklist or new policy or procedure your organization is trying to put into place, please contact us. Our form builder tool is highly configurable to really meet your specific needs in doing operations in this new era. So just, a few key takeaways. I think the pandemic really highlighted doForms' ability. We are a rapidly deployable mobile data solutions platform, and we are unique in the industry. Not only do we have incredible turnaround time to build very complicated platforms for workflows, but we have all those tools ready to go. Nothing has to be developed. We just put it together for you. And we have this rapidly deployable solution that can, meet your requirements of any type of business. So we're not vertical specific. While we do have vertical specialists, we're not specific to any one industry. And what's really rich and unique about that is that we pull in the needs of many different industries into a single platform, such that we're able to build solutions that maybe take something that we built in, for a construction company, but now it's being utilized by home healthcare nurses. And no other technology company out there really has that wheelhouse, that toolkit to pull from. So because we have all of this vast experience across all different types of organizations, and we're so easy to use, we're really able to rapidly deploy solutions to really get what you need out there. And in the pandemic, when things changed literally overnight, we were there to help our customers continue to do business and to operate effectively. And we were there to help. We were with policies, procedures, getting them back to doing business during the pandemic. One of the big things that I heard was, Lauren, the office is closed. I don't have access to our critical, contracts, our agreements, our work orders. I don't know what's going to be done. How can I manage my business? Well, by going digital, by using doForms, all of those file cabinets now became, cloud-based documents that were accessible anytime. So if people are working from home in multiple locations, they can get access to the information they need so that your business can continue to operate. May not be operating exactly as you want it, but you're at least able to do some sort of business. So it's definitely been a big year. We've done a lot, we've learned a lot. I'm just so impressed and proud to be a part of the doForms team, because the confidence with which we could roll out these solutions and know we were dealing with really critical information that meant life or death. The reliability, our ability to get out there and track this and get systems in place, just really, really impressive. And if you're looking for any sort of solution for screening or vaccine registration or anything like that, please contact us. We have the experience, the strategy. We know how to help you. So again, I think another takeaway, companies are going to continue to look to execute transactions digitally. I think they're learning it's more efficient, it's more expeditious. People expect it now. They don't want to share a PIN without a big sanitizing wipe over it. They'd rather electronically sign on their own device. And of course, as I just said, they understand the importance of cloud-based anytime, anywhere access to their information. And I do think, as the country is reopening, doForms is going to play a critical role in helping our customers have the tools they need to conduct and execute business transactions and meet, various state, local, industry-specific regulations, and help make sure you're having compliance with all of those new regulations and operational procedures. So we have a really big wheelhouse here to help you. We've learned a lot from the COVID pandemic, and we're just really excited. We think the future is really bright, and it's because of our customers and new customers, hopefully, that will be joining us soon. So I'm just going to wait. I'm going to see if there are any questions. That is my email on the screen. I would encourage you to join us at 4 o'clock. We have one more session. It's our last of the day. It is on doForms, our solution for home healthcare providers. If you're not in home healthcare, please still join. You're going to learn all about our other functionalities that can be applicable to all sorts of different healthcare companies, as well as some of our other pre-built solutions for healthcare verticals as a whole. But let me just see. Okay, one question came in. Can I build a custom form in your facility management workflow? Okay, so I think what you meant, these examples that I have, these are not pre-canned, like you have to use these forms. Everything we do is customizable via our form builder. So if you have a specific checklist or a specific questionnaire that you need built, we can do that for you. We also have form building trainings. We'll teach you how to build your own forms, of course, but you're not limited to our library. Same way with our screening tool. If you want to make changes or modifications to that, you're able to do that. So yeah, fully customizable to your workflow. Okay, and the last question, is this patient information? Is this patient information? Okay, it's a good question. So there's a lot of questions about whether or not if you're doing a COVID-19 screening tool, is that considered HIPAA? Is it patient information? While the lawyers and constitutionalists are having that debate right now, we like to say, why not, protect it, use best practice. It's good business sense to protect your information. So our advanced security features do ensure that you're using encryption, multi-factor authentication to view this information. So, while that debate is happening, why not just ensure that everything's protected? So yeah, so anything that's captured in our screening tool, especially students and minors information, as well as your employee information, protect it as if it's patient information. It's just good business sense. Okay. Well, those are all the questions I see right now. Thank you all so much for taking the time this afternoon. And I really hope to see you at 4 o'clock. And thank you again for joining us for Mobile Transformation Day.